For joining us.
Good morning, and thank you very much for having me on the program.
Let's go straight into it. How big a problem is it? Has it reached crisis proportion?
Now, the problem is quite significant at the moment. The debt is significant. It runs into billions. The Minister of Health and the DG are working very closely with the board to find resolutions to that. But obviously, for us to continue maintaining the high levels of services that we provide to provincial health departments, to all the public health hospitals, to all of the clinics, it's becoming increasingly more difficult. And as a result, we also compromise other partners that we work with, the vendors that supply us with the reagents and manage and monitor our instruments, etc. That compromises our ability to respond to all of that. So the cash flow crisis does present severe challenges for the board. It presents severe challenges for myself and the executive committee. But notwithstanding that, we continue delivering services to the entire country. And perhaps just some background about the National Health Laboratory Service itself. 8 out of 10 South Africans depend on us for their diagnostic requirements. In other words, it's a service that most patients don't feel and see. Because you go to a doctor, the doctor takes bloods, or he takes a urine sample, he sends it somewhere, and the somewhere is actually NHLS in the public health environment. We would then do tests on this, and we will help the clinician make a diagnosis. And in fact, if we make the diagnosis soon enough, the laboratory services is not just about managing patient care. It's not just about monitoring patient care. If it's used appropriately and judiciously, we can help provinces, hospitals and clinics, in fact, reduce the healthcare spend going forward.
But Mr. Pillay, it sounds as if to me it's the poor that suffer once again, because your counterparts in the private health sector don't experience the similar problems of not being paid by the department.
Well, we're the primary provider of diagnostic laboratory services to the public health system. And as you know, 8 out of 10 South Africans depend on the public health system for their healthcare. This diagnostic service is right at the center of everything. If I used an analogy, if the health system is the body, in fact, I would go so far as to say that laboratory services is the heart of it. Because a clinician, for 7 out of 10 medical conditions that you present with, will require some form of diagnosis to initiate treatment. So it's absolutely right that, and the general public needs to see laboratory services as a central part of the overall public health system.
And perhaps this is a question I should be asking to Dr. Aaron Motsoaledi, the minister himself, but according to your understanding, what is the problem? Is there no money? Is the money being mismanaged? Why are you not being paid?
It's a combination of problems, and the Minister of Health has been working very closely, and the DG of Health has been working very closely with us to explore alternative solutions, to find a way that will protect NHLS. And there have been discussions around possibly new ways in which the health services can be protected. I think the Minister and the DG have demonstrated repeatedly that this is a service that must be protected, because it could potentially cripple the entire public health system if this part collapses. And as you know, we're a state-owned entity, so we sit slightly outside of the public health system. We don't get any provincial allocations or any national allocations. The service is rendered on a fee-for-service basis. And provinces, we're in difficult economic times.
Mr. Pillay, we do need to wrap. We're extremely pressed for time, but I want to know what will happen going forward. Are you in danger of collapsing? What happens? How do we solve this?
Well, if there isn't a solution shortly, then it is going to seriously compromise our ability to continue rendering services to those provinces that are religiously and paying their bills. So I think that we'll continue our efforts with the Minister and the DG to resolve this. But time is running out in terms of a sustainable solution to protect this really well-functioning and effective and efficient service that South Africa owns and should be protected.
And needs desperately.
Indeed.
Very scary prospect.
Indeed.
Thank you so much for joining us. The CEO there of the National Health Laboratory Service, Mr. Saggie Pillay, just giving us some details as to what's happening there with regards to that very crucial aspects of the public health care sector.